Thank you, Paul. It's a pleasure and honor to be here, and thank you for inviting me. So my name is Sandeep Patel, and I'm here to tell you about an exciting new initiative that we're getting ready to launch that we're calling the Kidney Innovation Accelerator, or KidneyX. So I live in Washington, D.C., and I'm actually pretty excited today because for those of you who are hockey fans or from the D.C. area, we hoisted our first Stanley Cup last night. I was up very late last night watching. So I'm excited to tell you about this initiative. And I usually start off these talks by telling the audience about the sobering reality that people with kidney diseases face. And this is obviously something I don't have to tell you all. I don't have to tell you that you're among 40 million people in the U.S. alone with kidney diseases, that you're among the 100,000 new dialysis patients every year in this country. And I certainly don't have to tell you that other than tolvaptan, which was recently approved by the FDA for PKD, that there's pretty much nothing out there in terms of drugs to slow down progression. And that dialysis, when it was brought into market, was a great medical breakthrough along with kidney transplants, but that it hasn't really changed in decades. And there isn't innovation, there has not been innovation in decades. And that's something that we are trying to change with KidneyX. So we've embarked at HHS on a quest to reduce the need for dialysis as we currently know it. And it's not something that'll happen overnight. It's not something that'll be easy. But in order to do that, what we really need to do is to invite the smartest, the brightest, the most creative people in this country, around the world, and let them know that there are problems around kidney diseases and invite them to be problem solvers and to join you all in the fight for that. And so KidneyX is an initiative that we're launching at HHS with our partners at the American Society of Nephrology. There's a couple of folks in the back. And we're basically the foundational partners. This is not just us. We want to build an ecosystem with you all, with everybody out there, and align all of our work. But the real goal of it is to make, I would say, the impossible possible and the possible a reality. It's about expanding our notions of what innovation looks like, of what treatments could look like in this space, and to put in the mechanics and actually try to make that happen as fast as possible. And so we're going to do this by seeding the next generation of companies that can bring new preventative, diagnostic, and therapeutic products to you all. It's worth noting that right now, in the United States, this is the most productive innovation engine ecosystem that we've ever seen on Earth, right? We are living in a time where there's just unfathomable amounts of innovation. And we need to channel that as much as possible into your lives, into defining and finding solutions to kidney diseases. We want to give them a common purpose, a true north, as Paul likes to say. And we have a stake at HHS. We have several agencies, and I'll run through them in case you don't know. So we have our National Institutes of Health, which is the largest funder of biomedical research in the world. We have the Food and Drug Administration, which oversees the approval of new products into markets, into patients. And we have the Center for Medicare and Medicaid Services, CMS, that is the biggest buyer, the payer of healthcare products. And so we have these pieces within our organization. And our goal is to align them and focus them and have them partner with these companies to define this common goal and to get innovations through. And part of our goal, too, is to demystify the bureaucracy, right? So one of the things that holds back innovation is that nobody really understands how the FDA works, how Medicare works, how you get products approved. It's a black box. And so our goal with KidneyX is to make that as transparent as we can, to make it as easy as possible for innovators to understand at a really early stage what they need to do to get these products through. And so, actually, I'm going to run through a couple of these principles, which I think are important. So one is urgent. Well, patient centricity. This is an area where historically patients have not been at the center of designing new medical products, and we want to change that, right? We want to get you involved, and I will spend a lot of time talking about how I think we should partner with you. Urgency. This is really important. unlike cancer, unlike heart disease, we're not seeing a sense of urgency to solve, to cure, to really have impact in kidney diseases. And we want to create that urgency, create that fire, right? We obviously want things to be achievable, right? We don't want to have a pie in the sky idea of doing things that aren't grounded in reality, right? So we want to achieve real innovation. We want to be catalytic, right? So our goal is not to break down the entire system and start new. We want to do enough to get the wheels moving, to get companies working on new therapies, new products, investors to invest money. We want the engines to move, right? Collaborative, right? Innovation happens when people from different walks of life meet and talk and share ideas, right? This is the bedrock of innovation, and we want to create that environment. And we want to be additive, right? We want to address barriers to innovation. We want to be sustainable. We don't want to put our eggs in one basket and have it fail, right? We want to do it in a way where there's not just one therapy out there, but that we're investing in lots of them. And so KidneyX is going to take shape as a series of prize competitions. And I'll explain in a minute why we're doing that. But the idea is that each prize, we're going to offer money, and we're going to invite smart people, smart companies from across the world to and incentivize them to come and develop and think about developing new products, right? And each one of these prizes is going to be focused on a specific opportunity across the broader kidney disease landscape, across prevention, diagnosis, treatment. And we're going to start with, okay, well, I'll get in that in a second. So the other issue is that prizes are great because they're exciting, people understand them, there's money involved, and it's fast. So unlike the traditional ways we do things in government, right? We like to give out money through grants, which are great, but we tend to pray, not pay for success. And prizes allow us to say, we're not just paying for activity, we have a goalpost, right? And we want to pay you if you reach that goalpost. That's the idea, and that's why we're going through this prize. And there's a whole bunch of things that we're offering that are non-monetary, that are important, that I mentioned earlier, which is FDA and CMS, right? These are key players in this whole puzzle. And so we want to demystify, right? And we want to offer these companies access, understanding of how these agencies work, right? That's part of the process here as well. So we're launching our first prize at ASN's Kidney Week in October in San Diego. It's going to be a pilot prize, and it's going to be focused on identifying innovators from different fields, identifying technologies like new filters, new sensors, battery technologies, vascular access, tissue engineering, things that if we could identify them, piece them together, integrate them, could inform entirely new designs for renal replacement therapy, right? This will just open up the range of ideas that we can explore and to get these people kind of keyed in here, right? So that's gonna be the first prize. We're serious. KidneyX is if I didn't mention earlier, is a public-private partnership, and we wanna be serious and sophisticated about how we organize it. So we're gonna set up a governance structure. We're gonna be transparent. We're gonna do things the right way. And then we're gonna follow this up with a much bigger prize in the future that takes all the pieces that I talked about, all the technologies I talked about, and sets the goalpost of let's build devices that are real devices that are, get to trials as fast as possible, right? We're gonna work on that next. We're gonna also expand our focus to other areas, more upstream, prevention, diagnosis, other types of therapies like drugs. We're gonna explore those as we sort of move forward and define future prizes. And the other thing that I wanted to mention is we're in the early stages of thinking about what we're calling a venture fund, to build a fund of money, public-private, that could basically act as an investor to some of these companies. We've talked to lots of investors, lots of companies in this space, and the thing that we hear a lot is that investors don't want to fund in this area. They see it as a high-risk endeavor, and the thing they've told us is that if there was a fund that existed that could act as the lead investor, that could do the due diligence and say, these are credible companies, these are credible projects, these are exciting, that their money would follow that. And so we're thinking about how do we create this fund, and that'll come in the future. There's an important point here that I don't want to lose sight of. It's that innovation happens only when we first expand our notion of what's possible and then demand its existence. I spent a lot of my past career analyzing how innovation happens in a lot of different fields. And this idea of expanding the notion of what's possible is really fundamental, right? People don't invent things until they imagine something else exists, right? And I think that's one step that we have to take, and we're trying to do that with KidneyX. Now you might ask, in terms of demanding its existence, who should be the one demanding, right? Is it us in the government? Is it the industry? Is it researchers? And I want to tell you that it's something you probably already know. I think it should be you guys, right? It should be patients that are demanding, right? You have the biggest stake in this endeavor. And when we speak in government, we're essentially channeling all of you, right? We represent you, we serve at your pleasure. And so it's your voice that we're amplifying, and that's the way I think we want to keep it. And so I'm gonna get into our strategy here, but it's important to note that, I think you guys should be advocates for you and your fellow patients, but I think you should be something more. And we're trying to provide this opportunity with KidneyX. You have valuable and unique knowledge without which we cannot develop new solutions. And our goal is to create more opportunities for your insights to directly inform innovation at all stages. I want to make sure that each and every company, each and every team that passes through KidneyX, that receives funding and support from us, understands to the most minute detail what it's like to be a patient, and to understand the constellation of patient experiences that are involved. And I want patients to be actively involved in the development of medical products. The consumer products industry calls this process co-creation, and they've been doing this for decades. So Lego, the company that makes toy sets, they have a process where they allow users to design and submit new toy sets. And if enough people demand it, they're going to build and sell it. Nike allows consumers to design their own shoes. So if these companies, if we can do this for toys and shoes, why can't we do it in an area where the stakes are so much higher in people's lives and their line, right? This is the mindset that we're trying to change. Our former Chief Technology Officer, Bruce Greenstein, who just left HHS, was a dialysis caregiver for his mother for 14 years. And in every meeting that I had with him about kidney diseases and KidneyX, he never failed to remind me that the first day of dialysis, her first day of dialysis, was pretty much the same as her last day of dialysis. That nothing much changed. And he likes to joke that there are more channels on the television, but but other than that, it's pretty much the same. So think about that for a minute. In the last 14 years, we've built an entirely new economy in the internet age. There's so much that changed in the last 14 years. And I think we have to channel that pace of innovation into this space. And so that's part of our goal. So I want to lay out some of the different ways that I think you guys can help us at KidneyX so that we can help you. First is this co-creation process. So again, I want each and every company that passes through KidneyX to be able to work closely with you all. Even if they're at the beginning of their journey. So if during a clinical trial, that's the first time a company looks at patient preferences or talks to patients, that is way too late, right? They've already designed the product. They got to go do it much earlier in the process when they're just thinking about this. And so that's part of our goal. Again, we're trying to get early stage companies, new people thinking about this, and we want patients to be essentially partners as much as possible at that stage. Empathy, right? Innovation happens when people have deep insights into what people need. And so I want companies, again, to understand that. And so that might mean something as simple as, could we have companies spend a day with you all, understand what it's like to be you, right? So pieces like that, I think we want to build in. And that's going to be part of our strategy. And then that sort of gets to this idea of patient collaboration between N of 1 and N of a million, right? So we want companies to understand an individual and how they think and feel. But we also recognize that getting patient preferences involves sampling lots of you and asking lots of you in surveys and stuff. So we want to get that entire range. The other thing is that I want to ensure that no clinical trial particularly with the companies that pass through KidneyX, fails because there aren't enough patients. It is a ridiculous reason for a clinical trial to fail if there aren't enough patients. And so we want to change that as much as possible within KidneyX, and we're going to build that into our strategy of making that as simple as possible, engaging with you all, figuring out how best you guys want to engage in some of these trials when they come online. And finally, I want to know that KidneyX is working for you all, and so I want you to keep us accountable, right? This is not going to work unless it works for you. So now and in the future, keep track of KidneyX, talk to us, tell us if we're not doing something right, tell us, and make sure we're accountable, because that's the only way it's going to work. I'm going to pause there, and then I think you might have seen the Twitter handles at the bottom for KidneyX. I also wanted to add in my email and my Twitter handle in case you want to follow or email me. Please do so. I want to hear from you all. I'm going to spend the rest of the day here, so I want to talk in here and listen. But feel free to reach me at any point or reach our KidneyX team. Again, we can't do this without you, so thank you.
So here's the first round. A federal official who is putting his email up there, and he wants your feedback, okay? And this is actually one of the great things about AAKP and our ability to bring guests here. The sincerity and the commitment of those that are engaged on your behalf is real, but they need you to give feedback, and this is a great opportunity for it. Earlier, I mentioned some of the operating principles that we work on, and one of them is the principle of no surprises. The fun thing about being president of AAKP is you get to violate that once in a while, and I'm going to do so now. So before we begin the next session, I want to present a very special award. Every year, the president of AAKP has the honor of selecting an award recipient for the President's Award. And it's no small task. We see a tremendous amount of a talent that comes alongside us and works in the good fight. But what we've tried to do, and what I've tried to do personally, is to reach out and identify those folks that many people may not know, but whose day-to-day service and efforts in this field have made a tremendous difference over time, because that's really what matters, the continuity of it. And this particular person has been a strong ally for the organization, but it goes well beyond that. It's the ability to understand with empathy and concern the day-to-day struggle, and to understand the different types of equities that are brought into this system, from the medical professionals to the patients, how to bridge those, how to get them to work together, and how to involve patients with professionals. So his day-to-day job requires him to work with medical professionals, both here in the United States and across the world. But when you get to know him, you understand that he is probably one of the best supporters of patients in Washington, D.C. and around the country, and he serves on your behalf. He's very fast to analyze what issues are. He's a veteran of Capitol Hill. He looks for opportunities to plug patients into the process, and is relentless in his efforts to do that. And he's dedicated to making certain that policy outcomes and policy opportunities are substantive and long-term, and he's deliberative about how he operates and how he operates with his team. There are no stupid questions to him. He's always available to us. And so at this point, what I'd like to do is call Todd Abram from the American Society of Nephrology, the executive director, to the stage, because we're going to give him the President's Award this year from AAKP. And this is a surprise to him, so. Yeah, this is really happening. In lifetime, Todd. But this is a sincere honor, everybody.
So, nice job on the no surprises. As I said to Paul as I walked up here, I would have worn a tie if I'd known, so I apologize. What I've found over the last couple of years, and this is my 11th year at ASN, and it really is a joy each day coming to work. And we have a remarkable team of people. Many of you know Rachel Meyer, who runs policy for us, but there's a whole team around her, Melissa West, who many of you know from the Kidney Health Initiative and others. And so I think being able to work with that group of people is just wonderful. And I can say to a person, they're all dedicated to the mission of ASN, but also committed to making your lives better and really ultimately trying to find a cure for kidney disease. I think the second piece of it is we really have a wonderful group of members. For those of you who don't know, ASN members are health professionals. So they are physicians, they are PhD scientists, they're nurses and other caregivers, and that's our membership. And so we have to work hand in hand with the patient organizations, and I would say that AAKP is by far our closest relationship. And a lot of that has to do not so much with Paul, but with Richard, who really is terrific and is wonderful to work with. I think I'm not lying, right? I think the other piece of it, in addition to our staff and also our members and our leaders, and many of our members are in the room, looking around, I see Becky and I see Bill and others, is just a wonderful group of people in terms of each day going to work. But I think the final piece ultimately, and this is something that I've realized more recently, is that the patients and your experience is what drives the organization. And I think you'll hear that throughout the meeting as I was going through the agenda, and there are a number of nephrologists and other caregivers who are on the agenda. You'll hear from them what drives them every day is your experience and how to make your lives better. So I really appreciate this. I'm borderline speechless, which is saying something, so thank you very much. And again, to my friend Richard over there too, so thanks, Paul. I really appreciate it.